Hi, I'm JJ Allen, pharmacist at Sawyer Street Hometown Pharmacy in Oshkosh, and today I'm going to be talking about calcium supplements. Calcium supplements have been in the news a lot recently over the past few years. There's been a lot of negative reports on their effects on cardiovascular health and brain health. And the one important thing to realize with all these reports, the more and more researchers are finding out about the micronutrients, the vitamins and minerals. For all of them, there's a sweet spot to hit. If we don't get enough, we're deficient and our body has issues, particularly with calcium, bone health, and osteoporosis. And if we go too high, our body can have issues as well. Calcium, really high doses, may cause some cardiovascular issues. So the most important thing when considering a supplement is make sure that you talk with your doctor and your healthcare team and your pharmacist. When looking at calcium supplements, the first place to have everybody start is go onto the National Osteoporosis Foundation website. They've got a brief calcium intake survey that does a really good job of showing you if you get enough calcium from our diets. Fortunately, for most people in Wisconsin, we eat plenty of dairy products, which aren't so good for some things, but for calcium, they're great. Most people don't need a calcium supplement. But for people who do, the two supplements to consider are the Oscal and then the Citracal. The Oscal is the calcium carbonate. It's generally less expensive, so it's a place I like to have all my patients start. Some people who may want to consider the calcium citrate or the Citracal are people who take medications to lower stomach acid. Calcium carbonate's not absorbed well in a low acidic environment. So these would be if you take omeprazole or Prilosec, ranitidine, or Zantac. You might want to consider taking the Citracal. And as always, if you have any questions on any vitamins or supplements, feel free to stop in to any of our hometown locations and talk with our staff.